Good morning. Myself Dr. Ravina Kalyan, Faculty of Physiotherapy Department in RPIIT Technical and Medical Campus Karnal. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So, in this presentation, we'll talk about the facilitation technique of the ROODS approach, in which we will discuss about proprioceptive stimulation. So proprioceptive stimulation facilitates the muscle spindle, Golgi tendon organs, joint receptors and vestibular apparatus. So in this joint gives control over the motor response. Proprioceptors adapt more slowly than exterior receptors and can produce sustained postural patterns. So in which first is heavy joint compression. So definition. Joint compression is more than body weight applied throughout the longitudinal axis of the bone, according to Ager J. 1974. Causes are: first is co-contraction around joint under compression. Second is combined with oncogenic patterns with prone on elbow, quadruped, sitting and standing position. It can be applied manually or by weight cuffed or sandbags, as is known as the heavy joint compression. Second technique is stretch. Stretch means activate the proprioceptors in selected muscles and imply the principle of reciprocal innervation. So first stretch is intrinsic stretch. It promotes stability of the scapulohumeral region, bearing more weight on the ulnar side of the hands and promoting resistive grabs. Second is secondary ending stretch. It is a combination of resistance and stretch to facilitate ontogenic patterns. Once a muscle is put on a full stretch, secondary nerve ending, which is facilitated to the flexors and inhibitory to the extensors. Third is stretch pressure. Affects both exterior receptors and IA afferent of the muscle spindles. Pads of the thumbs, index and middle fingers are give firm downward pressure, and stretching motion is achieved if thumbs move away from the finger. So in this there is a joint compression to the elbow with stretch to wrist extensor in quadruped position. Resistance. In ROODS, uses heavy resistance to stimulate both primary and secondary ending of the muscle spindle. It is used in isotonic fashion in developmental fashion to influence the stabilizers. When a muscle contracts against resistance, it assumes a shortened length that causes the muscle spindle to contract, so they readjust to the shortened length. This is called biasing the muscle spindle, so it is more sensitive to stretch. Thank you.